Hello, everyone. My name is Dr. Richard Horowitz, and I am the co-host of the Doctor's Talk Healing Lyme Summit 2.0. It is my great pleasure to introduce to you today Dr. Eric Gordon. Eric has been in the field of Lyme disease and integrative medicine for, Eric, how many years is it? How many decades now you've been treating?
They're only 35 now.
35. So I've got you. I've got about 40 years, but
Yeah.
we're kind of up there. And he runs Gordon Medical in California, one of the largest Lyme clinics in California, seeing some very highly complex patients. So today we're going to be discussing treating the hypersensitive chronic Lyme patient. Those patients who just don't tolerate medicines and herbs very well. That's Eric's specialty. We're going to get into that today. So hold on there and just wait to hear Eric and I discuss how we're going to get some of you patients who are really chronically ill through the therapies. And Eric, thank you for joining us today.
Thank you, Richard. It's always a pleasure to talk to you. Yes, and
For me too.
Yes, and I've been doing the medicine part for 44 years, but I was doing regular medicine for the first 10, 12 years, and then I wandered off into the path of of the people who stayed ill. You know, they were supposed to get better after we did our magic in the hospital, and they just didn't.
Yes.
You know,
for all of us, truthfully, it was pretty much the same thing. When I moved up to the Hudson Valley, New York, back in 1987, finishing as a board certified internist, I was planning on doing standard medicine, hypertension, cholesterol, diabetes, but I always liked kind of like being a medical detective. You know, I started a Substack now, Medical Detective, and it actually is what I love to do, which is like differential diagnosis, figuring out why people are ill, right? And you have the same thing, right? You and I have kind of jumped into an arena with these very, very chronically ill patients, and we've had to figure out why they're ill, why they don't get better, and that's really what we're going to talk about today.
yeah, you know, I mean, absolutely, because the to me, that's what makes, I mean, you know, medicine fun. Fun, yes, it is. I mean, because to be honest, is that we've been doing this, both of us have been doing this a long time, and we're still happy to go in and see people, which I think makes us different than a lot of the doctors who are just seeing hypertension and diabetes. We
Yes.
and you know, but and one of the ways that I know that you do it from reading your work is that, you know, you have to look at the high level, you know, like what's the overarching story of what's happening in the body, you know. And for me, that's always comes down to inflammation, and those who've listened to me in other talks, always the cell danger response, because I just think it's a great story to understand how the body works. In my younger days, I studied a bit of Chinese medicine and Ayurvedic, but you know, never did it. A dilettante to say to even would be kind to me for those things. But what I found them so interesting is they had an overarching story to understand what's happening in the body.
Mhm.
And as a medical doctor, we were always drilling down to the organ or to the, you know, to the biochemical pathway that was broken. And both are useful, okay? But if you know, and that's the beauty of the work that I think most of the people that we work with do, you know, consciously or unconsciously, is look at the overarching, like how does inflammation persist in the body? Why is it happening? Why is the body not controlling it? And also drilling down and finding out, okay, it's this bug or this biochemical pathway that's off a little bit, or this toxin that's holding the system, not letting the body process the chemicals that it needs to process. And, you know, toxins will also cause chronic inflammation. And I guess as I look at this story, it's just each patient has their own history of how they got here. You know, in the earlier days, I'm sure when you were in the Hudson Valley and like being inundated with acute Lyme patients or semi-chronic Lyme patients, you know, just as I saw, when actually I didn't really see a lot of Lyme till I came to California, which is really funny. Just an aside, I was in upstate New York, further north. I was north of Albany, and in the 80s, we were told there was no Lyme above the Catskills. There was and being a
Right,
good
the ticks
doctor,
never crossed over. Right, there was the demarcation line.
the
Yes.
demarcation, there was no Lyme, and just so people understand why their doctors sometimes aren't helpful, because when you're not a specialist in an area, and in this case it was the 1980s, and the infectious disease doctors were telling us there was no Lyme north of the Catskills.
Yeah. Well, and it's interesting you bring that up because just today I posted on my Facebook account that there was an article that came out in Turkey specifically about talking about the two-tier testing and how there were areas where it's useless to use to even look and do testing because in this area there was no Lyme disease, except what they didn't discuss in the article is the insensitivity of the two-tier testing, that some of these people had positive ELISAs, some of these people had positive Western blots, but they did not put it together because they had to have the two-tier test be positive, right? And you and I both know that the sensitivity and specificity just doesn't match up.
Yeah.
And we're in the middle of a worldwide epidemic. So I don't care where you live at this point. BMJ Global Health just a couple of years back told us 14.5% of the global population has now been exposed, 1 out of 7 people, and people travel. So, everyone is being exposed at this point. Almost everyone I listen to who tells me they have a chronic fatiguing musculoskeletal neuropsychiatric illness, you're pretty much going to find the 3 Bs of Borrelia, Lyme disease, Babesia, and Bartonella, right? And mold toxicity and even long COVID now, underlying inflammation, right? Because we're finding a lot of mold, a lot of heavy metals, leaky gut and food allergies with mast cell activation driving it, the wrong microbiome. Lyme patients don't fall asleep or stay asleep. They're missing vitamins and minerals because they use them up with detox. And I call those in my 16-point MSIDS model the 6 rivers of inflammation, which cause 10 downstream effects of inflammation. As you mentioned, mitochondrial dysfunction, cell danger response, right? The hormones get thrown off. You get POTS dysautonomia, neurological problems, psychological problems, liver dysfunction. There's a lot of downstream effects, but as we started, it's all chronic inflammation, right? So you just have to figure out where the inflammation is coming from.
Yeah. And as you have pointed out so well, is that when somebody comes in and they have a left shoulder that hurts for a week and a right knee that hurts the next week, or a peripheral neuropathy that comes and goes, and think these bugs. Because, when we were trained in medicine, when people came in and told us that their symptoms waxed and waned and they were on one side, then or they were just one-sided, that's even worse. They were just crazy. They were neurotic. They were making it up. They were blah, 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 because that's not the way medicine understands how the body works. Well, chronic infections, I said, is, it was, I don't remember how many points, but your questionnaire is so helpful for people to see that, because this is not, rheumatoid arthritis,
Right. The migratory aspect, is the hallmark of chronic Lyme disease. And by the way, Alan Steer, even in I think it was in the late 70s, he already was publishing an early acute Lyme, the migratory aspect then. And when I published our validated symptom questionnaire with Dr. Phyllis Freeman and Dr. Melier Cetera, and this goes back to 2017, we looked through the literature to see what other diseases cause migratory pain. There was only 6 others. And I used to joke with doctors, unless you graduated at the bottom of your medical school class, you could basically tell the difference between chronic Lyme and acute hepatitis, acute rheumatic fever, gonococcal arthritis, inflammatory bowel disease, Reiter syndrome. Right? And the last one is lupus, which actually you could maybe
you could get
because there's a lot of itis inflammation in lupus, but if you do the markers of a double-stranded DNA and Smith antigen, you'll figure out if lupus is there, right? But there's only 6 other diseases that cause migratory pain, and it's not that difficult to rule them out ultimately.
Yeah. But unfortunately, doctors for a long time just ruled in that you should take some Prozac and see your psychiatrist when you came in with these things. So, but working off that model, realizing how many people have these things, and as you went through the litany really well, um, we have to be so careful today because we have people who are specialists in mold, which is really good, okay, and specialists in mast cell, which is very good, but those are usually secondary, okay? I'm sure there is somebody who has mold sensitivity that is just mold sensitivity, but I have not seen it. I really think that basically you first need the destabilization that Lyme does to your immune system to wind up with so your body no longer can handle the mycotoxins, because saying we co-evolve. This is the whole thing. We co-evolved with all these bugs.
Yeah.
So when things are working well, they should be nuisances not life stoppers, you
No,
know?
and I think you're bringing up a good point, which is, even years ago regarding the mold, I mean, I wasn't obviously checking for it the way that I am now,
Yeah.
but we're finding it now in the vast majority of all of our patients. And I'm sure it's from the climate with the hurricanes and the damaged buildings that are waterlogged. And I mean, we're seeing
Too
it in so
tight.
many
Yeah.
patients. But so do you find in your patients, because we're talking today about the hypersensitive patients, like the ones that just can't get through these protocols, right? Whether it's herbal or antibiotics. Let's talk a little bit about what do you see the biggest factors driving that inflammation, and what do you see the factors that are like how do you drive down the inflammation to get these people to tolerate the protocols? What are you doing specifically in your clinic?
Well, step one is looking obviously for mast cell activation. I don't think it's just mast cells, okay, but mast cells are because they're in a way probably the forebears of the immune system, okay, in multicellular organisms. They're everywhere. And they are very, very sensitive. They're part of our innate immune system, our first line of defense. So that's usually activated. But the thing about mast cells is that, again, we were trained to think about mast cells when people sneezed, had allergies, had rashes that we didn't understand, not realizing that mast cells are different populations, slightly different in different organs and different parts of the body. And so people can come in and just have the normal irritable bowel, a little bit of reflux, migraines, a lot of quote unquote urinary tract infections, but they don't seem to the cultures aren't positive, but they keep having urinary tract infections, and they actually do get better with antibiotics sometimes, but they come right back. When you start seeing all of these things, think mast cells, and again, if we can quiet down the mast cells, it will help a whole lot tolerating a lot of other things, and that's one of the reasons. I mean, anytime somebody comes in and they can't take herbs, I always think mast cells because the issue with herbs is they're plant materials, and plant materials, especially the ones that are concentrated, to have those nice chemicals, all those polyphenols and other good things that will stimulate your immune system. Well, they stimulate your immune system, but they stimulate it by irritating it. I mean,
Right.
this is the thing we have to realize is that most of the herbal compounds that really get a nice anti-inflammatory response do it by by irritating, by causing oxidative stress inside your cell, and then the nucleus starts to pour out a lot of anti-inflammatory signals, and that's what we count on. um, but when you're in that hyperreactive state, you don't get a chance to get that nice anti-inflammatory. You just get a pronounced increase in inflammation. So you'll take a drop or two of an herb or a capsule and you'll react. And we used to think, I remember in the early days, we thought people were herxing, you know?
Mhm.
And my point is, if it's a herx, it should be 3 days, 4 days, 5 days. But if it's persisting, it's not a herx.
Right. So you're bringing up the first really important point of our talk today about treating the hypersensitive patient is
Yeah.
basically mast cell activation. And the way one knows is that it's immediate hypersensitivity, right? It's like you touch something, you smell something, you taste it. Like I have some, histamine issues. I've had issues where sometimes I just will taste something and within seconds I will have a sneeze. And that's how I know, right? It's mast cell because I'm immediately getting a reaction, right, to that. So it's that immediate hypersensitivity. So with calming down the mast cells, are you finding like using an H1, H2 blocker, like using Zyrtec and famotidine to block histamine, using cromolyn sodium, using Montelukast singulaire, Cytoquel, Histoquel with, different herbs. What are your favorite things for the mast cell that you're finding is calming it down?
Well, these days, it used to be, we'd start with quercetin, but I'm using more luteolin now than quercetin because quercetin is a wonderful, wonderful compound, but it affects so many systems, okay? It affects estrogen receptors, and we just find a lot of people don't do so well. I mean, again, most people do, I shouldn't say, but again, we're talking about in the sensitive patient, I'm better off starting with luteolin. I have less of a flare. And I still like to, just because it's cheaper and simpler to start with, Allegra, Zyrtec. Um, but many people will I'll need to get it compounded in order for them to tolerate it, because that's the biggest issue with the really sensitive people is the fillers, and the other good stuff they put in capsules and in tablets. Um, Many of these people are sensitive to them, and especially the colorings, obviously. But even, I mean, there are rare, this is very rare. I don't want people to think this is happening to everyone, but there are people that even the the methyl cellulose, which is what we use in a lot of the fillers, even in
Mhm.
the compounded drugs, uh, well, they come from plants. And sometimes, if they come from palm trees versus a different tree or a different plant, people can react, which makes me
No,
crazy.
it's a great point. In fact, we use the main compound we use, which is Infuserve. I have a patient where she can't tolerate any of the ones you just talked about. Meth. She needs to use coconut flour or carrot flour. The only things that she can take, because her mast cell activation is such that when she smells grass outside, if someone's like mowing the lawn, she has an anaphylactic reaction, and
Yeah.
she needs to have like Midroll dose packs and stuff at home. And she is the most sensitive of all of the people that I've seen. So you bring up a good point. And PEA luteolin, by the way, with mast cell activation, they're finding it now in not just Lyme, Bartonella, and mold, but in long COVID, right? They're finding also in the long COVID population, mast cell activation is definitely playing a role in that group also.
Yeah, because I mean, long COVID, just for, I mean, one of the things that we have seen with COVID that is kind of mind blowing. Well, no, I guess it shouldn't be so surprising, but not only the activation of dormant EBV, but Bartonella. We have, I mean, like the amount of people who we see who we thought we treated their Bartonella, and they were sailing along pretty well, and then they get COVID or a few unfortunates the vaccine, the effect on the immune system. And that's what I'm, I keep hoping the immunologists will be helpful, but I just as an aside, I have found immunology is the most exciting and sometimes frustrating and useless.
No, I got it. And in fact, when I do the Radiance Diagnostic Panel for long COVID,
Right.
speaking of Bartonella, and I've
Yeah.
had this conversation with Bruce Patterson,
Yeah.
the VEGF, vascular endothelial growth factor, shows up often in these patients. And you can't tell if it's COVID that is causing the activation of the endothelium, causing an endotheliitis and inflammation with endothelial dysfunction, or is it BART, or is it both? And you're right, we see HHV6 reactivation and Epstein-Barr reactivation in this population. But you're right. I mean, they're finding in long COVID that it's not long COVID. It's turning out Lyme and Bartonella and mold are overlapping all these long COVID patients. So someone who opens up a long COVID clinic is essentially going to be treating the same kind of stuff you and I see all day long, because this is what people are getting these days. It's not like you can be a specialist in one disease, right? So many people are getting these tick-borne infections and toxins while getting long COVID overlapping with it.
Yeah. And oh, I mean, just as a shout out to the people with long COVID who, I mean, the most of the, I would say almost all of the quote unquote long COVID groups out there are engaging in something that's really good, but I call it Band-Aid medicine. Okay. It's like us treating mast cell. That's a Band-Aid. That's all we're doing. We're not fixing your mast cells. We're just like quieting them down. And that's what's so nice about actually when we can actually treat one of these infections, because when we remove the bug from irritating your immune system, sometimes the immune system actually will be able to find its way back to a calmer, more neutral place where you'll stop reacting. I mean, when Dr. Afrin, who I have to say, I mean, we've all been treating mast cell without realizing it, obviously, all these years. Every time somebody was herxing, what we were using were basically things that quieted down the mast cells. But to his credit, he's the one who really brought us, at least me, the clear awareness of what I was doing. And like I said, when people come in with with migraines and peptic ulcers and irritable bowel, and I get it. It's probably their mast cells,
Yes.
you
And
know?
and by the way, so and since you brought up with the bowel, I mean, and one of the places, I mean, because the mast cell activation happens from Lyme, it happens from BART, it happens from mold, it happens long COVID, but also the gut. A lot of our patients have leaky gut, right? You'll see this with long COVID, but you see it with a lot of Lyme. And the leaky gut, now you've got elevated zonulin levels as a marker of it. The molecules of food are getting across, right? And the immune system's reacting, and you get a lot of mast cell activation from these spreading food allergies. And we're seeing this all the time. And what's interesting is the inflammatory cytokines, because we're talking about inflammation in these chronically ill, sensitive patients. A lot of times, if you get them off those foods that are stimulating, right, these mast cell activations, they do a lot better because it's one of these rivers of inflammation going into the ocean of inflammation. So the gut is really an important point. And the bovine immunoglobulins, they're important actually for healing the gut. They've been important, for mold.
Yeah.
I take them personally every day, and they bind LPS, they bind lipopolysaccharides right in the gut, which is also stimulating some of those inflammatory responses.
Yeah. No, I mean, we find, I mean, quieting down the gut is not always easy, but is always worthwhile if you can, and that's what we started to use. Again, we use a lot of the of the antigen of the antibodies, like either colostrum or human we call them HO, the human oligopeptides, some of these products that actually are mimicking their synthetic mother's, well, they're taking the peptides that are in mother's milk, to lower the inflammation. If there's a hint, and since there is in almost everyone, of celiac, or not celiac, but just gluten insensitivity, especially if you're in America. Uh, we use things like lorazepam, which is a peptide that helps heal the gut a little bit and get those tight junctions working a little bit better. Keep the zonulin down. Sometimes it's not really a peptide, something called amlexinox, which was developed in Japan, uh, for canker sores, but actually has a global nice effect on the immune system, on kind of quieting down, and it kind of like gets the mast cells to quiet down, and again helps the gut. Because what's interesting is that most people also do really well with some of the other peptides that are out there in oral form, which is nice. Things
You're
like
talking like you're talking like thymosin alpha,
no,
BP57,
no, no. For the really sensitive, um, we start with things like TB4 frag, which is basically thymosin beta, but it's a piece of the thymosin beta, because when people have a mast cell activation, I find that the thymosin alpha 1, for instance, which is wonderful for acute infections, will sometimes stimulate their mast cells a little bit. So we try to avoid that in the beginning. And the the thymosin beta, the same thing. The full molecule can sometimes get people with real mast cell things in trouble. So the thymosin beta 4 works pretty well, for most people. I mean, there's still people who will I mean, there are people who react to everything.
Mhm.
And I wanted to explain to people just one little aside. Like, my population has gotten so skewed that sometimes I can be, I want people to remember that most people have a much easier time. When you're dealing all the time with a very sensitive population, you forget that most people will tolerate these things without any problem. But lowering that inflammation in the gut, is so important. I mean, and that's where, getting rid of the foods that are triggering you are important. But I always be careful. If you have too many foods that trigger you, then I would work more on taking stuff to lower the inflammation and leave out the big foods. But what scares me more than anything are the people who get to these restricted diets of like 4 foods and 6 foods that I can eat. And you really can get severe malnutrition. I mean, like at levels that, I mean, you just can't get the nutrients that you need. And it's, I mean, restrictive diets are my least favorite thing.
No, and
Necessary band-aids, but don't get married to them. Okay, they're like, they're just be
And
careful.
especially because when you restrict the diet that much, I mean, there's certain, as since we're talking about the gut and the effect on inflammation, you need the right type of bacteria in the gut. You need bifidobacteria. You need, right, you don't want too much Prevotella. You don't want too much Clostridium. You want Akkermansia species. Like there's ones you want in balance. And if you're restricting your diet that much and not using fiber with butyrate,
Oh,
right, you're not going to get it. So that's why in the morning, for example, I have a yogurt and I put in a teaspoon of organic flax, organic black seed, and organic hemp seed, right? So I'm getting all the good fibers in there as my prebiotics. So my probiotics have something to grow because, right, all the immune system now, we're finding most of the immune systems in the gut, right, in the Peyer's patches and rest. And in fact, I'm now starting to use a new product, Immuse PDC Activate, which is activating uh, the Peyer's patches to make alpha interferon because of all these new viruses that are spreading. So yeah, the focusing on the gut and getting the right bacteria, healing the leaky gut, getting off the allergic foods, absolutely for these sensitive patients. It's a key. Just like also the ones who are overloaded with the toxins, you've got to unload the toxic load in some of these patients. The ones who say, "Listen, I took 25 of Dapsone," and you and I just before we came on, we were discussing that low dose Dapsone is actually an excellent anti-inflammatory. It hits myeloperoxidase and it lowers inflammation. I've had guys in the 80s who thought they had Alzheimer's who took 50 milligrams of minocycline and 25 milligrams of Dapsone, which barely causes any symptoms or anemia, come in a month later and go, "Oh my God, my brain woke up. I feel great," right? Because low dose, it's an anti-inflammatory. It won't be enough to hit the biofilm persistiforms of the bacteria, but it does lower inflammation. And if you have to use something like that, right, early on, just to calm things down, it's fine to use it while you're unloading the toxic load. Because I find also the people that tell me they can't tolerate anything, I've got to unload the toxins in most of these people. Are you seeing the same thing in your
oh,
population?
absolutely. I
Yeah.
mean, but again, we have that same circle. For most people, unloading the toxins which is number one. But unfortunately, well, actually, but if the mast cells are activated, when mast cells are very funny. Well, they're actually like people. I think everything in our body is like us, is a reflection, is that when they get really irritable, even if you make something better for them, they get irritable. You
Mhm.
know, just ever some people you can't, there's some people you can't please. Well, your mast cells can get like that. We don't want that to happen. But so even unloading the toxin, decreasing the toxin load, just change can be perceived as a danger, as a problem signal. And so that's when you got to go super slow. But yeah, but the toxins, I mean, my personal belief is that the reason that we are seeing sicker and sicker and sicker people is because of the toxin load that's gone up. And, it's been climbing over the last 100 and probably 20, 30 years, maybe 40 years. Because remember, in the 1920s, the good Dr. Warburg was probably saved, from being executed and by
This is the one
Hitler.
with the this is the one with the Warburg effect. That
Yeah, yeah, well, yeah, but he was the guy who figured out this Warburg effect. But the point is that the reason that we think the reason that Hitler didn't kill him didn't, is because he was doing breast cancer research, and that was very close because Hitler's mom died of breast cancer. But the point is, the Germans were really into looking at cancer because cancer was like a new pandemic
right.
epidemic
And
in
now the
Germany.
problem is, and you probably saw this just about a month ago, they talked about all of the food packaging that we are now getting. You go to the supermarket, but buy food, there's hundreds to thousands of carcinogenic substances. Not only in the food we're eating, just trying to get the packaged food, and then you get wildfire smoke in California. We just had some from the Catskills and where we are and down in New York. There's hundreds to thousands of chemicals in there that are all
Yep.
carcinogenic. And people's detoxification pathways, they're not used to handling it, which is why you can eat the healthiest diet in the world, but you need support, right?
Yeah,
So talk to
absolutely.
me a little bit about what kind of nutritional supplements and herbs do you like for the detox support in these hypersensitive patients? What are you finding you're liking?
Well, it's super. They're they're different. I mean, I use anything. I use little bits. In fact, I often tell people start with toothpick doses. Stick the toothpick in the powder and take whatever sticks. But I go through them all. Anything from Pectosol. I mean, because because it's just gentle.
Yes.
Um, it's just the bentonite, any of them. I just
Right.
go through
You're just using very tiny doses when you're.
very tiny doses to start to see what they can tolerate. Zeolite, if you just when you get it, you just make sure that you actually get the from the company from the companies that they have really checked for parts per billion of lead, especially because a lot of our the same thing with methylene blue when we get there. I mean, there's a lot of stuff out there is contaminated, and especially something like zeolite, which is kind of got a box shape that's designed to hold on to metals, and
Right.
you
Well,
want to
well,
make
that's why you
sure.
have to go through a compounder if you're doing it that is reliable, who does mass spec, checks for heavy metals and checks for all this stuff, right?
Yep.
That's part of the reason I love InfuServe in Florida because they do all of this. They're like one of the best compounders I found in years.
Right. Yeah, yeah, and we have to be sure that we're not taking more toxins in with what's going out because but it really is about just lowering the load slowly. I mean, saunas, to be honest, saunas, if people can tolerate the heat, and I said even if they have some orthostatic hypotension and POTS, I just remind them that be hydrated and literally crawl out of your sauna. You
Right.
know, I mean, just don't stand up and walk around the house. No,
No, and only stay in
lie
there maybe
down.
for a couple of minutes with a light
Yeah,
sweat when you're
yeah,
starting.
yeah, yeah. Get out of there and lie down for a while, and just understand that. But I mean, sweating is still probably our safest and best way of lowering the toxin load in the system. But
Right.
and yeah, and spending if you can afford it, I mean, because the organic food is not perfect, but it's better.
Yes.
I mean, it's not perfect because I mean, what I know it's not perfect because I still find extraordinary levels of glyphosate in people who I know are eating extraordinarily clean diets. It's frightening
Yeah,
how.
and speaking of that, this is why actually, and I just had a conversation with one of the practitioners about fulvic and humic acid about taking
Mm.
something that's going to start pulling heavy metals naturally and glyphosate naturally, which is humic fulvic acid. Do you find in your very, very sensitive population, you can use tiny doses of this and get them to
Yeah, but I
tolerate?
have to be again. I have to be careful. I have everybody. I mean, we've yeah. That's it was the good Dr. Cheney many moons ago who made that point. And I have found that humic and fulvic supplements they're amazing at removing and also delivering the trace minerals. I think they're really great source. I think that's a very good idea.
Yeah.
Yeah.
Yeah. So, so for those again listening, I'm speaking with Dr. Eric Gordon about chronic inflammation and the very, very hypersensitive patient. And we were just talking a little bit about detoxification through the skin with saunas, through the gut, making sure your bowels are moving with actually, good fiber, which is also great for the microbiome, making sure your liver detox pathways, your phase one, phase two pathways are working correctly. Hydrating, dilution is the solution to pollution, as Sherry Rogers used to say, right? Staying adequately hydrated. Regarding the liver, Eric, there's a couple of products I use, and again, I have to be careful also in the very hypersensitive, but in my population, Zymogen makes a product called MedCap's DPO dual phase optimizers, and they're using like diindole methane and sulforaphane glucosinolate for phase one, phase two. Lots of minerals. Magnesium is in over 300 detox enzymes. Are you finding that some of these combo products in your sensitive population can be used, or they have to really just take these individually?
I tend to use them individually.
Yeah.
Once people are going, I mean, there's so many of them now, I kind of like let them get what they want. But to begin with, I start with, the sulfuranes, the broccoli products, individually. I think that tends to work best. The magnesium, simple things just like, a gram of vitamin C will help your bifido grow, help the right bacteria in your gut. Because
Right.
we don't, I mean, that's going back to the gut. I just want people to understand when they get their stool tests back, don't, or especially some of them that are telling them like, the keystone species, you don't have to have all of them. Have a few, you'll be okay. We don't know. I mean, what's supposed to be living in your gut is a little bit, it's like immunology. We learn something new every day. And it's clear that we don't have any absolute truths yet.
Mhm. Right.
in
And yes, no, and I absolutely agree with you on that. So getting back to liver a little bit, I just want to ask you in your
Sure.
sensitive patients,
Sure.
when I want to block inflammation, I usually block NF-kappa B, one of the major, switches inside the nucleus that turns on inflammation, with N-acetylcysteine, alpha lipoic acid, glutathione. Do you find in your population, you're again starting with like very low doses of NAC and glutathione, because glutathione is the master, obviously, antioxidant. It's detoxing. We find, for example, in those people that come in with blurry vision that say, I went to the eye doctor, I got blurry vision, they can't figure out. We know it's neurotoxins. I'll give them 2,000 milligrams of glutathione orally once a day for a week. Half of them will come back and go, my vision's normal. It's like, you better get checked for mold toxins. You get it right because we knew it was neurotoxins. Are you again using microdosing in this population
Well,
for
to
blocking
start with,
NF-kappa B?
yeah, just to start. I mean, we could. I mean, like NAC. I mean, I've been burnt enough times with NAC when I start at 600 or 900 milligrams, and they don't feel well. So we'll sometimes have them start as low as 100 milligrams. Most people will do okay there. It's just it goes when when you're moving toxins in the body. One of the great problems is that we are a big chemistry set, and if we take 10 molecules out, there's a good chance that they're in some kind of very arithmetic balance, mathematical balance. So if we take 10 out of your gut, then sometimes another 10 get released from another part of your body and get recirculated. So if your liver isn't up to it, or whatever organ it happens to be near isn't up to dealing with it, you'll get in trouble. I often find my big thing with detox, though, the one is I do a test that not many people do. I look at folinic acid because many of our patients don't do well or don't respond well to 5-methyl tetrahydrofolate. I mean, even I'm not even talking about the people who can't methylate and they just don't respond. It just doesn't help. And it turns out that many people make antibodies to the receptor for 5-methyl folate, and folinic acid doesn't get into the cell quite as well, but it gets in directly. It doesn't need a
Mhm.
transporter.
And
And
by the way,
so
that's why I use both with the dapsone protocol.
yeah, no, I
That's
know
why I'm using
exactly.
leucovorin. Yes, you know that.
Yeah, yeah, yeah.
And I find that when I use them both together, I seem to get a better effect as
You
far
get
as
it right. Because
inflammation and health.
again, the thing about our populations is they're so varied. I mean, everybody's is, but once you've gotten, I say, I think my way of looking at it, once you have a chronic illness, okay, the trigger, whatever caused it, is not the biggest problem. The biggest problem is how your body is responding to it,
Mhm.
you know, and that's about you. And that's why what worked for your brother or your uncle or your cousin may not work for you as well. And it can be very, very frustrating. But no, I go slow. The same thing with the glutathione. And what is that? I remember when I first started doing this, I was just so perplexed when I had a handful of patients who even low dose glutathione intravenously would make them sick for not just for a day, but for a few days. And it was like,
Those are the ones who are overloaded with toxins that they
yeah,
just no,
they
yeah.
just they can't move it, and they're minerally depleted. I think
Mhm.
that's one of the things I learned from everyone. The naturopaths who work with me over the years. I said, especially Dr. Parpia, who really is one who has kind of really worked on the detox before doing much else. And I think being all the physicians, we want to fix quick. That's the way we were trained. I mean, that's sort of like being in the early years in the emergency room, and it's like, I want to fix that fast, you know. And having a more gentle approach and watching when she repletes the minerals and some of the amino acids, the detox goes easier. I mean,
Mhm.
and again, it's something coming from a medical background, unless somebody was overtly deficient, in something, we didn't think about it. It wasn't really part of it. I mean, if you had rickets, we thought about vitamin C, I mean, you,
Vitamin D, yes.
vitamin D, vitamin D. Vitamin D is rickets, yes. Okay. Scurvy is vitamin C. I'm sorry, I'm getting old. I can't even get my vitamins straight. Oh, but we didn't think about it. I mean, like, and realizing that almost everyone today is deficient. in many of the trace minerals, and
So
it
you bring up a great point, which is to detoxify properly. Magnesium is in 300 enzymes. Copper
yep,
you need for superoxide dismutase to handle those free radicals, oxidative stress. You need zinc for phase one liver dysfunction properly. And we find that when we test, we don't just check serum mineral, we check red blood cell minerals. And
yes,
a lot of times the serum magnesium is normal, but the red blood cell magnesium is low, and the serum copper is normal, but the red blood cell copper is low. So that's a good point. You brought that up, that when you're dealing with these really sensitive patients, you've got to check the mineral levels both in the blood and intracellular with the red blood cell, because you're right. We find we have to replace the minerals. I use Minorextrum Zymogen as a basic. In fact, I take it myself every day. I used to cramp up, by the way. One of the things, like people who have asthma, irritable bowel, low back pain, and cramps, the common denominator actually is magnesium deficiency, right? And we see this. And I found that my asthma is much, much better since I got off my allergic foods and take glutathione,
yeah,
which, believe it or not, is a bronchodilator, and take magnesium. Like, I never have to use my bronchodilator anymore since I figured out the tricks to get the inflammation down.
yeah, lowering the inflammation and getting the vasodilatation
Yeah.
to work in the system. But anyway, so going back, so the supporting the basics is like so important. And again, it's something that I used to skip over because, I thought, oh, here, just give you this to detox, and people didn't do well. And so we just go back, supporting the minerals. And when it comes to glutathione, these days I've been experimenting with the spray on glutathione, which looks pretty good. I've had some really, good responses. Um, if people would, I
That's, you're talking derm just because your population is so sensitive, you need to use a dermal product.
well, but the absorption seems to be actually better. I
Hmm.
mean, I can't. I mean, they have one study. I'm not sure that, again, when something new comes out, you always wonder, is it that great? But it's something called glutaril, and it seems to be working well. I'll let you know for sure. But I've been very happy with it. It again, if people have a super sensitive nose, I can't smell it at all. To me, it doesn't have any smell. But people who can smell it all, of course, can have that hint of sulfur, which they don't quite like, that rotten
Right. I
rot
mean,
sulfur.
the brands we use, most of the glutathione we use, which has been shown to be
Yeah.
effective, is the Surtria brand. Surtria is in pretty much most of them. And
Yep.
of course, we do use liposomal, and Research Nutritionals makes one right there.
Yep.
There's automatically a liposomal where they showed it even has good RBC absorption in the red blood cells. So, I mean, there are a lot of good brands out there, but
Right.
we're
Yeah.
talking
I,
about
I just for the
hypersensitive
people
patients.
who, like, when they put things in their gut, doesn't matter what it is, they're having trouble. So I
Yeah.
like to have I like to have options. And a lot of these things are developed early on for the autistic population.
Mhm.
And they're always a good place to start.
Um,
Um,
Speaking about inflammation, I just
yeah.
earlier before we got on, we were also mentioning a couple of things. The other pathway that blocks inflammation, I want to bring this up for people, is the NRF2 pathway. You were speaking to me a little bit earlier about using turmeric, curcumin, apart from broccoli seed extract, resveratrol, EGCG. You want to just talk a little bit about dosing and why stimulating NRF2 to lower inflammation is also in your population and mine also, why
Well,
you find it to be useful.
Well, it's just the body's way to lower inflammation, and if things are if the cell is cooperating, it's the nicest way to go. I said when we were talking about, I always used to start with quercetin because it's cheap and easy, but at these days I've been using more luteolin because I've had not a lot. I've had just enough women who've had trouble with who estrogen levels, can really affect them, whether they have a history of endometriosis or something of that sort that we want to be really careful with. So I find the luteolin is nice. Resveratrol, I tend to use more. I tend to just have people on low dose Japanese knotwood, which is a good source of resveratrol, but also
Mhm.
has, I think, a lot of other factors that work together. Um, and it's part the EGCG is funny because it wasn't something I was big on for a long time for no good reason. Sometimes it's just I'm not, I'm very sensitive to caffeine. So I didn't like green tea. And so the EGCG I put on
Oh,
the
so it's not
side.
like these 6 espressos a day I used to take like 10 years ago. Every hour, it's like, I don't smoke. So it's like, oh, I have an espresso. But by the way, as I've gotten older, it's like, my body's not doing that anymore.
Yeah. But anyway, so but they work really well. And I'm looking at, but I just think mixing them, I think the Japanese knotwood, by itself at a low dose, just maybe like 100 milligrams or something, is really a nice way to start the anti-inflammatory process going. Um, but then again, and if you, especially if you add in, just having the gut a little healthier, the combination of the two, getting, once you get the butyrate normal, and you lower that LPS you talked about, the lipopolysaccharide, which is such a non-specific irritant for your self-defense system.
Yeah.
When you lower that down, the inflammation comes down much, much better.
Another pathway which we haven't discussed, and I think it's important, the NLRP3 inflammasome, which is a lot of people, which we see it in line with microglial activation in the brain. You see it with Alzheimer's, with a lot of neurodegenerative. I love low dose naltrexone and I love low dose
Ah,
melatonin. So have you been able to find that low doses of these are able to be used in your population?
wonderful, wonderful. I mean, the low dose naltrexone is an oldie but a goodie. And I'm thrilled with that, because when we first started using it 20, 25 years ago, I didn't get as good of success. And I think it was just like they said, but the how it was compounded. But now it seems everybody's doing it right. I mean, the success rate in the last, I don't know, 5, 10 years has gone way up. But it's still dosage. It's still frustrating because most people can, down 4.5 or even 9 milligrams, and
I'm on 4.5 every
yeah,
day is what I take. Yeah.
yeah. I mean, nobody notices it. But I have patients who literally, 0.1 milligram, like a tenth of a milligram, is just fine,
Mhm.
so I usually start people at 0.5 and
Mhm.
see what they do with it. But again, these tiny doses, I want to emphasize for people. Most people can start at 1, 2, 4. They'll do fine, but
Now
you
we're
already
talking about
know.
the
Right.
hypersensitive Lyme patient. Yeah.
You're the person who, like, you don't even want to see a doctor anymore because everything they give you makes you sick. So those then start at the 0.1. I mean, but for 99% of the population, don't waste your time and money doing that. Start at a reasonable dose. Don't make yourself crazy. Because LDN is such a beautifully, it's just a beautiful, I mean, I say a beautiful drug. It really is. It seems to help so many people, fatigue, but just sensitivity. I mean, its anti-inflammatory effects can be immense. I've had a few people with long-standing, interstitial cystitis that we try that have, really worked through the world, and they find the right dose, and it quiets it. So I'm a
And by
great
the way, in a
fan.
lot of those patients with IC with interstitial cystitis, we do find Lyme and Bartonella is
Oh,
underlying it, right?
well,
And mold also. Yeah.
again, Lyme Bartonella triggering your mast cells all the time, because you can get some purchase by treating the mast cells, but that is 100%. There's um the way Lyme and Bartonella, I did a review of this, and I have to admit I have forgotten it, but I looked at Lyme, and this it affects every aspect of your immune system in a gentle way in most people. But I kind of look at it like, if you have, if your body, it kind of can suppress a little bit in one in your T cells, just a little bit. And for most of us, doesn't matter. Okay. But if your T cells if your Tregs are already not working well because of toxins or just genetics and toxins, then you're in trouble, because without those Tregs working, you're suddenly going to be making antibodies to everything in the universe.
Right. And long
And
COVID. is causing T cell exhaustion in people. So we find Lyme and Bartonella can cause chronic variable immune deficiency with low
Yeah.
immunoglobulins and low subclasses. Now you get COVID, where you're reactivating Epstein-Barr and HHV6. You're getting T cell exhaustion with low natural killer cells, and and then of course mold toxins, which are immunosuppressive. And now your body is very sensitive, right, to these infections coming in, and you're more susceptible.
Yeah, and just to put it in perspective, it just has I like to think about how the body works. We call it T cell exhaustion, um, but it's like so many things. It's the wrong name. Those T cells aren't tired or exhausted. They've just gotten the message to chill. Okay, because if a lot of those, the NK T cells, which are often the population that's quote unquote exhausted, if they keep going at full bore, they're going to hurt you because they're going to kill cells and you're going to start losing more than is good for you. So your body, a lot of these exhausted or functions that aren't working well, just have reached a point of a truce with your system. So that's why doing the work that we're describing of putting you back together piece by piece and not trying to just go through the front. What I call going through the front door is when you have Bartonella or Lyme, you go in, you take antibiotics or take these days the herbal things, in full dose, you get better. That's going through the front door. And that works, thank God, for lots and lots of people. But if your body says no to those things, if you try that and you get sicker, then you have to go back and layer it. And starting in the beginning, usually with toxins and quieting down the inflammatory cells as best you can. And
Right. Work on
a
the toxin load, work on the gut and
yeah,
detox pathways first, right? Before
yeah.
you're going to go headstrong into those.
Before you're going to go into, well, your body will tell you because I don't think not everyone has to have a long process. But you probably know if you're the person who is sensitive to the environment, if lots of things bother you, because I mean, it's unfortunately, it's usually not just your gut that will be sensitive, but also it's your whole nervous system, because the nervous system is your brain does control everything on some level. And so if you're somebody who, uh, you're super sensitive to sound and light, or just people's anger, or people's emotions, there's a good chance that your immune system is also going to be very sensitive.
Right. And we find in this hypersensitive population that, doing limbic retraining neurofeedback, right, is absolutely essential, whether it's the anti-hopper DNRS or it's gupta AIR or primal trust or some of the vagal devices, their wiring, right, the wiring of the limbic system from the toxins and the
Yeah.
infections, to calm it down, we find that these limbic retraining neurofeedback is absolutely essential in a large part of our population.
Yes. Yeah. No, for people who can do it. And I always say, if you tend to be a little bit on the obsessive side and not too fatigued, I think the DNR is great. But if other people, I'm more like, Gupta or what's this fellow? Ben Aarons has a program where I forget I forget the name exactly, but Ben Aaron, very nice because each one of these are different and you can see snippets on YouTube usually and get
Mhm.
a feel if it fits your personality type because
Yes.
they all work if you use them. Okay, they all will help you, but if they're the wrong, if they don't go down well, it's about taste and flavor, um and so don't do one and go, oh, this is terrible, and don't try again, because this is not about, we're not telling you that you have a psychological issue. I got news for you, we all have psychological issues. Like I said, I've never met a normal person yet, but our basic habits of how we respond to the environment, they affect our immune system. And once we've been sick a while, we are living with a little bit more fear because we know we can't trust our bodies the way we used to. And you don't have to, but if you can quiet that down, it will help. Your immune cells will be much happier in the long run. Because
No,
the
it's a good
same
point.
chemicals that run your brain talk to your immune cells. Your serotonin and dopamine, they're not just here. They're on your white blood cells. So just
Excellent
relax.
point. So, Eric, we're actually, believe it or not, we're getting close to an
I
hour.
know, I noticed. I mean, we could talk
So
forever.
before we leave, I just want people to know, how can people contact you at Gordon Medical? What's
Well,
what's the best
we're
email?
very simple, just gordonmedical.com. And there's a website tells us all about us. all the practitioners who work with us and how they, because we're all different. I mean, I think that's one, and we have lots of YouTubes that people, oh, not, I don't think they're YouTubes, are they? But they're, got to be careful. But, lots of videos that people can see, because one of the things that I've discovered, it's so nice when people know who you are, because if you need somebody who's ABC, then talking to me who's AB, FG and the rest of the alphabet isn't going to suit your psyche. You're going to feel not comfortable. But we have doctors, who are much able to like be straight, A, B, C, D and walk you through it and not go too fast. So you have to find the doctor, no matter where you're looking, that resonates with you, because otherwise this is a hard process to recover from these illnesses.
Right.
And
And they can learn more about the other therapies you have because we
oh,
could be on here for
we have a ton. We have a ton
plasma
because
because
everybody needs something different.
right.
I mean, and so we're out there just to serve as best we can.
Very good.
And
Eric, it was a real
the
pleasure.
sun is shining
Yeah,
in and blocking
yes,
me all out.
I don't know that you're sundowning there, but yes, it's coming down. So, Eric, it was a great pleasure speaking to you today. Thank you for taking the time. So, for everyone listening, my name is Dr. Richard Horowitz. I'm the co-host of the Doctor Talk Healing from Lyme Summit. Before Eric completely goes into the black here, we've been talking about treating the hypersensitive chronic Lyme patient today. Again, it's gordonmedical.com if you want more information. Eric, thank you for taking the time today. And for those of you who've been tuning in, thank you. We'll be seeing you again for another episode soon.
Thank you, Richard. As always. Bye-bye.